Well, good morning. Thank you so much for taking time to join us for our second and what we hope to be annual event. It went well last year, and we took a lot of recommendations and tried to make it a little bit better this year. So we all hope it'll be worth your time, but I think it's going to be a lot of fun. The first talk for this morning is going to be presented by Dr. Deb Kegelmeyer, who's a professor at Ohio State University and a professional exercise researcher. So, come on up.
Hi everyone, thank you for having me here today. I'm so excited to be here. What I'd like to talk about today is just a little bit of a snapshot. So what is exercise? And kind of look at some of the more interesting studies that are out there rather than, does this advance it or does someone else advance it? No? Okay, so talking about what exercise can do for you, I want to talk about the type of the exercise program. Does that matter? What about physical therapy versus community exercise programs? And what about intensity? So exercise, what can it do for you? Does someone else have a clicker for slides or do I? There we go. Awesome. Oh, I should give you my disclosures. I am under contract periodically with Honda Research and Development and work with them on some robotic devices. I am a board member and part owner of Nuvanta LLC, and I have a textbook through McGraw-Hill. So again, those are my objectives. What I want to get through today. So what can exercise do for you? I think we're all pretty aware that it can help improve fitness. Most of us, when we think about fitness, think about cardiovascular fitness. So we think about having more endurance. But we also need to have good strength, so enough muscle to move us and lift us and do the things we need to do. And fitness also includes flexibility, being able to bend and get into the positions that you need to get into when you're trying to move around and do your daily activities. But exercise can also improve functional things. It can help you walk better, it can help improve your balance, and it can help improve cognition, and that's a really exciting new field. And finally, it can help prevent falls, and that's my big area of research. It's a challenging area to make improvements, but it can do it. So what about physical fitness, and what have some of the studies shown? So the exciting news if you have Parkinson's disease is when people have done exercise programs and they've done research, people with Parkinson's disease, physical fitness improves, and it improves rapidly. So exercise is a great thing, and you can definitely improve from it. Now, if you do, people who do endurance training programs showed big improvements in endurance. People who did just a strength training program show big improvements in strength. But most of those studies with those types of programs, walking, balance, quality of life, don't improve. So we're going to talk about why that is and what that means, how we make sure that we get those improvements as well. But we know now that people with Parkinson's disease can make really big improvements in their physical fitness. What about walking? This was a cool study done by a friend of mine through the Parkinson Foundation, and they had people, a group of people doing a progressive resistance exercise program, and then the other group was doing a PD-specific multimodal program. And what is a PD-specific multimodal program? Well, some examples of those are the Move Big program. The Delay to the Disease program here at OhioHealth is a PD-specific multimodal program. And power. So those are all examples of the type of program this research might be talking about. So in this graph, you can see that over that 2-year period, that light gray bar in the background are control subjects. And then the 2 lines are the 2 groups of people with Parkinson's. So the people with Parkinson's started out lower functioning, and as soon as they started that exercise, they really started to improve. And they ended up right in the middle of that bar with the control subjects. And the exciting part is that they didn't get any worse over 2 years. So a lot of research keeps looking for improvements. Improvements are great and we always want those, but also in progressive diseases, we're looking to stop the progression of the disease. So when we see people not getting worse, that's really good. So we want to get people up to their best level of functioning, and then we want to keep them there for as long as possible. So the red bar on there are the people who were doing the multimodal exercise programs that had a little better effect on walking, and then the gray bar is the strength training program. Individuals who did the strength training, what they said was strength gains did not transfer to gait. And what they mean there is that the stronger you got did not mean you got better at walking. So you get a base level of strength that's required for the walking, that gave you the benefit you needed, but strength alone and strength training more and more doesn't necessarily translate to function. So what about balance? I talked about balance. I'm really big on balance. That's kind of my obsession. This one, they did a balance exercise group, and the other group did resistance exercise. The group who did the balance exercises, the real specific ones, improved in balance, probably not in strength. And the strength training group did not improve in balance, or even got a little bit worse over time. So it's talking about this, what we call specificity of exercise. You get what you train. So one of the reasons why these multimodal programs can be very good. And they're doing things here, like you can tell they're kind of walking on obstacles. Well, you guys can't see the slides, but they're walking on obstacles and trying to move around and do that kind of thing. Exercise improves cognition. So it helps people to think better. And there was a study done where they had people doing treadmill training, and I'm a big proponent of treadmill training. It has a lot of benefits for people with Parkinson disease, and it's an aerobic exercise. Typically, when we look at studies that include an aerobic exercise, then we see improvements in cognitive function. And in this study, they saw improvements in executive function, that's how you problem solve and think, and that was really exciting to see that kind of cognitive improvement. So it showed that you can do that kind of a program, at least a treadmill training program, and improve cognition. Most of the studies in people with dementia or Parkinson's, or just in people who are older that show that they improve cognitive function, are doing some type of an aerobic intervention. There's also some studies that look at individual exercise versus more group programming in cognitive function, and showed better improvement and more prominent improvement in the individual programming. So really hitting at and getting the person to work to their peak performance helped. Exercise can reduce falls. Now, falls are a big deal, and people with Parkinson's disease tend to fall a lot, and it's one of the big things we're trying to stop. So we don't want to see any more falls. Injurious falls can have a huge negative impact on people's lives. So one of my things, and a lot of researchers, is can we stop and reduce falls? And basically, anymore as a researcher, I'm like, I don't want to ask that question or make that my answer, because it's very hard to get that improvement. I can get people to walk better, I can get their balance better, but knocking down the number of falls is a big challenge. So when we get a study that shows a reduction in falls, that's pretty exciting. So this particular study looked at a lot of different exercises and things that could reduce, that they put into the program to try to reduce falls. So they had a lot of balance exercises. You can see that they were having people reach forward, do step-ups, lunges, things that had them move around and really challenge their balance. They were doing a lot of postural adjustments, things like that. But they were also doing some stretching and strengthening exercises. So kind of a very balance-focused, but all-inclusive exercise program, and they reduced falls. Doesn't matter what type of program you do. There's so many out here, and I've mentioned a number already. And so the question is, there's research studies that show Tai Chi is effective, dance, cycling, the Move Big program, exergaming, boxing. So does it really matter, and how do you choose which program you do? Well, we have a lot of those programs available in this community, and it could well be that I don't even know about some of them, so I'm certainly not trying to be all-inclusive. But I know that we have the Dance for Parkinson Disease program. That one's offered through Ohio State, and it's not at Ohio State, so that's the good news, because even I hate driving there. And if you've been down to the medical center lately, I think they're trying to make it impossible to get in or out. I feel like I've gone to a hockey game when I go to and from work anymore, but it's out in Clintonville, so I'll put that out there. Of course, there's the Delay the Disease program that's at OhioHealth. There's Rocksteady Boxing in town, and then there are Power and Nordic Walking, and PD Next Steps are offered around. Power and Nordic Walking are at the outpatient OSU clinics on the east side for sure. So how do you pick which one to do? Well, it's not really about which of those it is. It's about what exercises are in the program. And is it a well-done program? So does it challenge what you want to improve? So if you really want to improve strength, does the program you're going to work you on strength? If balance is your big thing and you want to get your balance better, does that program include balance activities and really challenge balance? Because as I showed in the earlier studies, you get what you train. Or is it an all-inclusive program? You feel like it's really challenging you on all fronts, then you can kind of hit everything and get everything better. But is it doing those things you need it to do? Is the program being run in a safe manner? So do you feel safe there? Do the instructors think about safety, and are they trying to make sure that everyone's safe? Are they cognizant of people's limitations? Do you enjoy it? That's the biggest deal, because I can tell you from my profession that getting people to exercise is not an easy job. The physician I work with goes in and says, take a pill, and by golly, all of you go home and take that pill. I say go exercise, and 6 months later people come back, and our social worker will go in, and she comes out and she has this evil grin, and she's the nicest person, and she'll go, they're not doing anything you told them to do. My husband, my sons, my dog, my patients, no one does anything I tell them to. I don't even do what I tell me to do. So exercise is a hard pill to swallow. People are really reticent. So if you don't enjoy it, you're really probably not going to do it. I had a client, we told him to go to physical therapy. We told him to go, every new exercise program that would come up, we'd tell him about it. Go here, go there, do this. Nothing, nothing, nothing. Younger guy, needed to be exercising. Boxing came to town. He goes to boxing all the time now. You couldn't get me in boxing. So a lot of reasons, but you couldn't get me in boxing. I'll go to the dance class any day, but see, I danced all my life. He probably didn't do ballet like I did. So different strokes for different folks. What you enjoy is what you're going to do. So the good news there is that you can pick and choose. You can make what you enjoy do what it needs to do for you. You just have to make sure that program includes what you want. And does the program you're going to focus on PD-specific elements? So you want to make sure that they're including encouragement to move bigger and move faster. Do they encourage you to extend or get straightened out? And does that program challenge balance? Those are kind of the PD-specific things that we don't always see in an exercise program that you want to make sure is getting incorporated in your regular routine. Exergaming is a big thing out there. Video games, our lab even did a research project on it. We looked at Dance Dance Revolution as a way to work on balance. There's been some studies, there've been some nice results. This particular study, and one of the ones that had the best results, actually created their own video game that was specific to Parkinson's disease. So the exercise program in that video game was made to help people move bigger and faster, help people extend, all of those kinds of things. And when they did that, the individuals that did that program actually did better than the conventional balance training. So exergames, things like the Wii, those can be a lot of fun. I think as we move up in generations that grew up doing those, we're thinking, well, those individuals are going to be more engaged in that kind of activity, might enjoy it more. There are a lot of programs coming out now. There's one out that's specific to stroke patients. There's Mercovo, Ability Arts is a painting one that anyone can do that's for balance, but it's very specific and meant to be used. Both of those, the stroke one and the Mercovo Arts one, are made to be used with therapists, but specific to help people have more fun doing their physical therapy. We're kind of desperate to get you to do what we want you to do. Physical therapy versus community exercise. So what's the difference and why would you do one or the other, or maybe do both? Typically, physical therapy is much more effective than a generic group exercise program in clients with Parkinson's disease. But you can't do physical therapy all the time. If you want to and you go, your physical therapist will be kicking you to the curb eventually, right? Because your insurance won't cover it. And I think that's appropriate. We need to do things in the most financially responsible way. So in that study, they did show that the physical therapy group did better than the exercise group. I think the point is, are you getting the most individualized maximal challenge? And one of the better ways to do that, and what's now out there in all of the national recommendations, is that you see a physical therapist periodically. A lot like you see your doctor. So we would say you should see a physical therapist at first diagnosis. Then you can find out, what do you really need to work on individually? If there's something that you need specifically addressed, you can do that individually with a physical therapist. Then once you get that addressed, they'll discharge you into a group program. You do that group program until you develop some more problems, have something new come up, see that physical therapist, get tweaked where they can be very individual in addressing that issue. Balance is one of the challenging things, so maybe they can really work on that balance with you, get it tweaked back up, and then back out you go to the group exercise program. Also, she can tell you, or he, that therapist, you know what, you have that stenosis in your back. And the thing that's going to bother and hurt that stenosis is when you do these two exercises. So whatever group program you're in, don't do those. Now that group instructor doesn't know that, can't possibly know that about everyone in the group, but you can learn that about yourself and then know how to make better use of that group program and make sure that you've got it individualized to your level of challenge. Intensity. Intensity is starting to drive me nuts. Everybody's talking intensity. And I kind of go, I'm a researcher, so what do you mean by that? Because that's a big word, really. So I decided that, like all things, I Googled it, okay? Google is the only place, right? Turns out that intensity is the quality of being intense. Gazing into her face with disconcerting intensity. That did not help me. So I went to the next one. It's the power transferred per unit area, where the area is measured on the plane perpendicular to the direction of the propagation of energy. And I went, okay, I'll send that to my brother, the engineer, who works on making sure our submarines make no noise, and I don't understand half of what comes out of his mouth. He doesn't listen to most of what comes out of my mouth. So I went, that's not really helping me either. So I went to the dictionary. Come on, Webster's. The quality of being intense. That's a black box to me. So the quality of being intense, you should not be allowed to define a word with the word. Really, you should not. I mean, come on, what are we talking about here? All right, so I was left to my own devices. So when we're talking about intensity, and you're hearing that in the research world and health professionals, well, there's a lot of ways that we can measure or challenge intensity. We can go after aerobic intensity. So when we're trying to make something aerobically intense, we're trying to make sure that you're breathing hard, that your heart rate gets up, right? That's going to improve cardiovascular function, and that's aerobically intense. I mentioned earlier that we think that making sure you hit some aerobic intensity is important for improving cognitive function. We can do intensity through strength. So strength is intense, or strength training, when you can only lift the weight a few times, Or if your muscles, you know that your muscle's too tired to lift that weight again. I can make balance exercise very intense. And if I really want to improve balance, I need to do that. In order to be intense with balance, I have to put you on the verge of losing balance. One of the reasons I recommend some individualized work on that one. For cognition, you have to hit the right intensity. So now we're looking at challenging thinking. So making it so that you can barely solve the problem. None of my students particularly like that one. So we look at things like how many repetitions did you do of the exercise? Or it could be the amount of resistance we put on, or the time you spend exercising, the number of days you spend exercising. What's the speed of the exercise? Am I making you do it a lot faster? That's an important intensity element in the Parkinson's community. Or I can make something really intense just by having you do two things at the same time. So you might have had, I know that a lot of the programs, I know David at Delay the Disease does this, I know we do it in our clinic a lot, telling you to do things like walk and recite the alphabet or count backwards. So there we're trying to get that intensity by doing more than one thing at the same time. So there's a lot of ways to go after intensity. So I think it's a more complex issue than we always give it credit for. And there's a lot more that needs to be done in the research area on this. So we have studies that show it needs to be much more intense, and I can show you studies that show the other direction as well. So I think of it like Goldilocks. It has to be just right. You do too much, you're going to cause damage, the body's not going to have time to heal, it's not going to get better. You do too little, you're not going to challenge yourself. Without the challenge, we don't get improvement. So we have to hit that sweet spot of just the right amount. And that's the tricky part. So to intrigue you on this intensity thing, because we've kind of swung around on it, this was a study, pretty well done. The participants did a treadmill training program, and they did low frequency, medium frequency or intermediate frequency, and high frequency. The low frequency group did it twice a week, the intermediate frequency group did the treadmill training 3 times a week, and the high frequency group did it 5 times a week. Now it's important to note, for those of you who are lazy like me, that they did walk on the treadmill for 45 minutes. So they did a good solid exercise program. It was just how many times a week they did that. And the interesting part is, notice that in all of these walking and balance parameters, only the low frequency and intermediate frequency group got better, and they're the ones who maintained it over time. So we see them getting faster or taking less time to do this timed up and go, and we see them having many fewer falls, and we don't see that in the high frequency group. So their clinical recommendation, there's that sweet spot. There's the point where perhaps you're doing, that 5 times a week maybe wasn't allowing enough recovery for the body to absorb and make improvement. Sleep is not a passive time. What we've shown is that students do most of their consolidation of learning while sleeping. If you don't sleep, you don't learn. So I liken that to this. When we do exercise, we kind of cause micro damage, actually. We kind of really challenge that body so that it knows that it has to come in and build up, whatever it is. But it needs to have the time to do that building up. So we have to get that just right balance. So my conclusions: challenge yourself, but then let your body rest and recover. Of course, I'm going to tell you exercise is good, and do the exercise that you enjoy, because that'll get you where you need to be. Thank you so much, and I do want to make a special thanks to all of my students who challenge me and keep me learning, to my collaborators, Dr. Sandra Kostick and Dr. Ann Cluse, who make everything possible, and Dr. David Hinkle and OhioHealth for inviting me here today and always being willing to collaborate with me on projects.